case study that we're going to look at is the case study for the modular mask. And I'll give you a little summary about what the modular mask is and why did I create it. I noticed like in the beginning of the height of the pandemic, there was a lot of face masks, PPE, supplies that were short in demand, and nurses were going online and asking for help. And I was like, well, what can I do? And that's what started the initial idea for the modular mask. The modular mask is, I can kind of show you because I actually have the physical product. So it's a prototype mask, and it starts off with a chin strap because a lot of I addressed all the issues that the nurses had, like with the earlobe fatigue and not having enough masks for the masses and being safety. So I addressed this with, I started off with a chin strap. And the reason why I started off with a chin strap because to combat the earlobe fatigue. So it doesn't go around your ear, it goes around your head. And a lot of nurses were wearing that anyway. So, and this is also for individuals who might have autism or head sensitivity. So this one will go like around the back of your head instead of like around your ear. And then there will be an attachment of a couple of different face masks, and I call them mask caps because they're like the cap of the mask. And so these are actually interchangeable. So here's like one, and then here's the second. And so you just interchange them around, and then you can double them up with an additional face mask. And then you can also add on an eye shield that if you wanted to. So you can also add on an eye shield. So the reason why it's all in different pieces to, again, address the lack of resources. So if there were enough mask caps for individual mask caps, then that will hopefully, supply and demand that you can have one chin strap and you can wash it. And also the fabric, this is also a fabric face mask. And it is, and I know I'm going to butcher this, microbial, which means that it's basically self-cleaning. The materials I use were very, very, very important. So on the outer shell is actually organic hemp and organic cotton, which is a natural deterrent for bacteria, moisture. So there's a lot of health properties. And also this face mask is reusable. And so it doesn't, and we using natural resources, which is the natural fabric. And then inside the face mask, it's either you have two options. If you have sensitive skin, I would get the organic, the silk and hemp, because most people who wear face masks, they get a lot of moisture, and that comes in and it starts face irritation. And so that's what I was looking at. The face mask has been around for like thousands of years, and it has never changed. So I wanted to bring something different to the table. And I had to make all these considerations, which is what I used was the value creation. How would this impact society? How would this help someone? That was my thought process in regards to componentizing the face mask first. The second one was design thinking, thinking about who would use it, how would they use it, is it beneficial, and and would I be addressing other issues? And so those are the things I wanted to focus on, because the face mask wasn't necessary. It's been around for years. So I didn't focus on what was right. I focused on all the things that was wrong that people were complaining about. Like with the earlobe fatigue and the mask not fitting, and then also the mask not fitting different faces. And that's another reason why I decided to do a chin strap, because it's actually adjustable. So you can actually adjust it to your face, and everything is completely separate. So you can buy them completely separate. So if you lose one piece You don't have to buy a whole brand new mask. You just buy what you need. And so that addresses the lack of resources. And then on top of that, it's like for fuller faces or narrow face, it can be customized. So it can go wide. So it can go like wider out. Sorry, I have my glasses on and I can still see. So it goes wider out, or it can go very narrow. My daughter is about 13 and she can also have one of these on. And so it is that versatility that's really important. And again, I'll start going back to the actual material. And so this is silk inside. And like I said, silk and cotton for those faces. And it's the same thing here. And it does come in 2 colors and right now. And this one is for, this is my prototype. So this doesn't have the anti-fog vinyl, but you get the idea. So now if you read lips, you can be able to talk with an individual and still be safe. And it is Velcro inside. Actually, it's like some really strong Velcro. So the Velcro is so you can also wash it and clean it. There's a nose bridge so you can pinch the nose to tighten it. And then if you need to clean it or you got some, or it got messy or something, you can just take it off, throw this in the washer, and then wipe this down with some mild soap, and then put it right back on and start talking. And all you have to do is get individual mask caps, and you can get like 5 mask caps of, these are only 2 of the prototypes of what we have. So we have one without the valve, which I don't have. And this one is the valve, and this one is the mouth shield. And then also the eye shield also comes in the 2 different sizes. And also I wanted to talk about, like, because there was an issue, and I wrote an article, it's also on the website. If you go to the modularmask.com, I did an article about the front valve. Now on the N95 mask, I did have a prototype, but I think I threw it away because the cat got on it. But anyway, so the N95 mask, it does have a front valve. The front valve is actually, it should be illegal because it actually, you can actually spit out particulates and absorb particulates. So it's not even safe. The reason why my mask is a little bit different is because I positioned the valve, and I'll talk about the actual valve because I know people were asking about that. So I positioned the valve above the nose and above the mouth. So when you talk directly into the mask, and that absorbs in the fabric. And when you breathe, it goes also into the fabric. And then if it does get to up here with the valve is actually very unique. And I'll go through the valve itself. So when you breathe, or if there's any particulates, they go through this little hole. And in this, you see there's copper. So there's a copper mesh. And this is the same copper mesh that they actually use in some laboratories. It actually kills the virus within 4 hours. And if it gets through that mesh, if it gets up to the hole, gets through the mesh, then you have a gasket. And up here, there's that gasket. And it's a rubber gasket. That's a one-way gasket. So it doesn't, you can't breathe in, but you can breathe out just as fine. And if it gets to that gasket, there's only 2 holes at the top, so air can come through and circulate. And also there's this, there's also this shield. So I know I went a little too far with these valves, but I wanted to make sure that you were absolutely safe. This is reusable. All you do is pop it out. It's a hole actually here. And you just pop it out and you put this in a washer, wash this with mild soap. And yeah, and that's about it in regards to the modular mask. And now I get into the case studies and what I actually, how I actually created it. And I'm just looking for the site right now. I think I might have to share the whole screen because I don't know what everything is. Hold on just a minute. Sorry about that. I have the Figma file up for everybody. Let's see. There we go. Let's share that. Okay, there we go. So here's the modular mask, and I will minimize that. And so this is a case study that I used to start the innovation. And it's like an overview of the project. What exactly is it? And I'm going to publish this and send links to everybody. So you, this is a lot of text. So I try to narrow down as much as possible. That's why I'm kind of paraphrasing through the talk. So these are the main challenges that we want to address. So the first challenge is people need a mask that fits properly. They needed it comfortable to wear for long periods of time. It's microbial that provides air filtration and can be replaced, cleaned, or exchanged. So the challenge 2 was a single-use plastic product that, oh, we're talking about the environment. Instead of, let's see. So we were talking about single-use plastics to contribute about 60 to 95% of the global marine plastic pollution. With an increase of use of disposable masks, the new source of microplastic fibers are being introduced into the environment. So since COVID, we've had a huge impact in regards of disposable plastic and disposable masks. And so that's another reason why I wanted to address these issues. And then the third is, covering up a user's mouth presents accessibility issues for those who are hearing impaired or need to speak to someone else. And during our research, we found out that more men had hearing issues than women. And then I had to investigate a little bit that, so men in general they're in what we interviewed for, that they had color blindness higher than women, and also they had hearing issues more than women. And so if somebody who reads lips or communicates, this will be essential for them. They can still communicate. So the solution was the modular mask. It was reusable, it's adjustable to fit user faces properly, it's comfortable, can be worn long periods of time. I've worn the chin strap and I forgot it was completely on. It does protect both the wearer and people around them. It has, let's see, it has the visible face shield, and that it's actually better for the environment. And then this can be, I forgot another component of it, is that there are little pockets on the side with Velcro that you can, if you wanted to add a reusable filter, you can put filters in the mask. So you can add to that protection also. Let's see, and then, so here's some of the case studies. And some of the case studies, we interviewed a number of healthcare workers, and we kind of compiled an archetype of, based off of general questions. So this is, I think this is like 10 healthcare workers, and we narrowed it down to one, and we called her Tiffany. And so Tiffany, she's a critical care nurse that works COVID-19 patients. She works long shifts, and she needed a PPE protection. And so these are the things that, this is the type of archetypes that I use to make sure I'm also on the right track. It's very good to have, most people use personas, but I use archetypes because they're behavioral, because we want to understand, like, is this product negative or is it positive? So having these archetypes is very important. And there's 3 that I use. And we go with Ben. He's a single parent, and, you know, he has a child, and he feels frustrated that he has to go out with his child, concerned about cross-contamination, bringing it back home. And I know you've heard stories about that, because children under 2 should not wear a face mask. But they can still get COVID, and they can still give it to the entire family. And so having something that's, you know, that's not cross-contaminate might be helpful. Then we have our 3rd archetype, which is Norm. He's older and in a senior community, and, you know, he misses, you know, he misses collaborating. He misses conversations with his friends, his colleagues, his loved ones. And we have to be aware that, you know, because COVID with the lockdown, our senior community is really hurting because they yearn for that interaction. And so it's really important that we do mask up and wear the right type of face mask to help these individuals. And like, again, I already went through the problems. And so I'm just going to go through these slides. And then if anybody has any questions, I am more than happy to answer. And so these are just some of the common problems, which I talked about the environment and our carbon footprint. I talked about, like, it was very painful to wear. Here's pictures of nurses that had like bruises from their personal protection face mask. And then, you know, and then also being safe about people, individuals around them, and also about accessibility. And again, common problems with the vowels, and also understanding your user. Children don't like wearing face masks. So I also developed a solution for that also, that we're still doing research and case studies on, and physical prototyping. And then this is actually where it started. It started from a drawing, and it went to a paper prototype. So here's the other drawings that I started with. I ended up nixing that because that was a lot. And then it went to a paper prototype, which is the physical prototype. So it went from a drawing to a physical paper prototype. And then here's iteration number 2. This is one I'm about to make the fabric prototype. So this is actually, I had to create a pattern. And then here's the final prototype, which is what I was showing you earlier. I did file for a patent on my design. And so I filed that in October the 28th. So it is a patent pending product. And that's it. Again, if anybody has any questions, I am more than happy to ask. Answer. Answer.
It's late, it's Friday. Okay. So, in terms of advice in terms of, you know, moving forward your prototype, what would you recommend in terms of mindset? I know a lot of people say just dive in, do it, don't, you know, be afraid. How do you get over the mental health of going from one stage to another?
How do I go to?
How do you get over the mental health of going from one stage to another?
Yeah, that's a great question. It was really hard because for me, it was like, am I doing the right thing? And then the problem was so big that I was like, am I addressing everything? You always second guess yourself. And that's why, like, one of these, like, I'll bring out this. So collaboration is key. So while you're doing your value creation, which is basically you have this great idea and you're like, oh yeah, I want to save the world. You're like innovator with a cape, and you have this great idea and you're trying to push on to the next level, but then you get stuck. Am I doing the right thing? Is this enough? Is this what people need? Or, you know, should I just toss it? Is it going to cost me too much money? Collaborating. That is going to help you get over some of those hurdles and get yourself out of your head sometimes, or take a walk or do something else. It's innovating is hard. Or like, you know, having ideas is sometimes it comes easy, but then following it through that process, there was multiple times I wanted to give up. It was like so many times I wanted to give up. But my 13-year-old like, Mommy, you can do it. And I'm like, okay, if the 13-year-old can say I can do it, I need to, you know, pony up. And then when my mom has severe asthma, so she can't go outside. The space mask possibly can help her. And so I was just thinking about the possibilities of how many people I can help. And I had to get out of my own head. And sometimes you need other people around you to help you get out of your own head.